Broadcasting live from the Business RadioX studios in Phoenix, Arizona, it's time for Phoenix Business Radio, spotlighting the city's best businesses and the people who lead them.
Good afternoon and welcome to Collaborative Connections radio show and podcast sponsored by KLM Consulting. I'm your host, Kelly Lorenzen. We're coming to you live from the comforts of our home while Karen Nowicki is in the studio producing at Phoenix Business RadioX inside Mac 6. Collaborative Connections is a radio series created to bring entrepreneurs, nonprofits, and associations together to build relationships, foster collaboration, and grow a stronger community together. Our hope for today is that listeners and guests alike will walk away with a golden nugget or a new resource for their business. The sponsor of our show, KLM Consulting, is an on-demand concierge marketing and project management firm with over 17 years of award-winning business savvy. KLM Consulting helps fast-growing companies and entrepreneurs build, brand, and brag about their business. Today, I have the honor of being in the studio with three amazing people that I'd love to introduce you to. Thank you all for being here. Terri Morrison with Terri Morrison Consulting. Thank you for being on with me.
Thank you.
Who happens to be my mother as well. I'm excited. and fellow entrepreneur. So thanks for being on with me.
You're welcome.
Stephanie, thank you for being on today. We are new to each other, but you own Concierge Senior Care Management and referred by Kimberly. So thanks for joining us today.
You bet. Very excited to be here. Thank you.
And Kimberly Mitchel, our Home with Help specialist. She owns Home with Help. Thank you for being on with me today.
Having me.
We know each other very well. Kimberly and I started working together volunteering for Girls Rule Foundation. And then now we get to work together in business. So thank you for being on. Today, I wanted to talk a little bit about each of your businesses and highlight some of the work you're doing in the community, what you're up to. But I'd also like, to have listeners hear some of the tips and tricks and insights you've had along the way in business. So feel free to add that as well. But we'll start with Kimberly. Tell us a little bit about you, where you come from, so people know the background and how you got started in Home with Help.
Okay, so I'm from Phoenix, born and raised. I did not live in this country for about 14 years, so I'd be cheating if I said I was 100% native. My husband and I met while living in Puerto Vallarta. He's Canadian, and we have two girls. And my senior story starts with my great-grandmother, who I was blessed enough to still have around when I was 25. And I had both sets of my grandparents as well. And we, unfortunately, it's just part of life, but we got to see each one of them in their different stages and different needs of moving them into assisted livings or having help at home or hospice or, all the different sort of healthcare levels. And it just seems like a good fit for us to go into this industry and to help seniors and hopefully learn from the mistakes that we were dealing with some other companies at the time, and hopefully do better and serve all the seniors better.
So tell us a little bit about Home with Help.
Home with Help is a non-medical home care agency. So we provide caregivers into seniors' private homes and help them with any non-medical needs like bathing, dressing, meal prep, doctor's appointments, that kind of thing, with the idea of keeping them safe and independent in their own home as long as that's a possibility.
Yeah, it's so nice to have that extra help. I know when my grandma was sick, my mom and I were trying to do all that ourselves, and it's not possible with, running businesses and having kids and trying to take care of your elderly loved ones. It's just not possible. So we loved, obviously, before we met you, we love, the home care place that we hired to take care of. It's just eases, it's nice for the senior, I think, but it's also really nice for the people who, the other loved ones that are trying to take care of them. Such a relief.
it's a peace of mind that they know that they're getting their needs met, and then your relationship doesn't have to change, because usually they now, instead of being the daughter, granddaughter, whatever the scenario is, now they become the caregiver, and that's not always ideally the relationship that they want to have.
I know. It's so nice. And so where do the caregivers, how do you find your caregivers?
The best way is when we get referrals from other caregivers. Sometimes we have to advertise in a variety of different resources. Of course, mostly everything's online now. And then the process is my husband or myself will always interview each one of them. And even during COVID, we still have them come in, we just sanitize and masks and all the things, because we want to have a face-to-face with these people, because we're going to be sending them into a senior's home. Obviously, all the, background checks, all those kinds of things are done when they're in here. But I'm sure in some other industries, they just do online kind of interviews, and we are not choosing to do it that way.
Yeah, I think that would, you can tell so much more about a person when you see them, in person, and tell their body language, and right?
Exactly.
Well, thank you so much. Stephanie Russell, Concierge Senior Care Management. Tell us a little bit about your journey, how you got to where you are now.
Sure. So I've been a nurse for just a little over 20 years. I first started working on a cardiac unit in a hospital. I lived in Louisville, Kentucky at the time. Spent many years in the hospital systems, more the acute care setting, did some traumatic brain injury units, skilled rehab, a little bit of hospice at that time. And then I specialized in dialysis, and I was traveling between probably 12 to 14 different hospitals between Indiana and Kentucky. And then I moved to Arizona and decided I really wanted to move forward with end-of-life care. So for about 8 years, I was in executive leadership with 2 different hospices here in Arizona. And then I started working with CEOs of hospital systems to try to identify how we could help reduce some of these readmissions into the hospital system. And then that led me to work alongside a new research collaborative that's now here in Arizona that helps to target those readmissions into the hospitals to keep seniors safe at home and avoid those unnecessary hospitalizations. And now, since I'm finished with that, I'm ready to focus on my passion of patient advocacy.
And how did you get into that? Or what led you to do that?
I've been doing that probably most of my career. I think a lot of people in the medical field do. We're patient advocates, but in our own setting, giving those resources, guiding them, because it's so overwhelming for patients and families. They're thrown into a circumstance that oftentimes was unexpected. They're unfamiliar with the resources that are available to them. They just know that they have to do all of these things right now. So that's, over the years, what I've seen is just those family members and patients just being so overwhelmed and not knowing what's available to them, where to start, who to trust. And that's what drove me to move into patient advocacy full-time now, so that I can help empower them to manage their medical condition and age in place safely, and bring those resources that are trusted in the community to them.
That's huge, especially for out of state, like we talked about earlier, out of state people that have loved ones here in Arizona, that you can be that patient advocate for them here.
Yes, and with technology, now we're all using it because of the pandemic. But I'm actually able to be that person who can do the LinkedIn or the Zoom platform, FaceTime, whatever we need to do to have the family be as involved as possible.
Yeah, I assume because a lot of them, wouldn't know how to use that, right? Or even if
Yes.
they do, if they're sick and don't and are out of it a little bit, they need somebody to help. I know Terry's a huge advocate of having a patient advocate. She's been our patient advocate my whole life, and for my husband, who got really sick and was in the hospital. Like, come on, what are we gonna do? Come on, who's taking care of him? What are we working on? So it's so huge to have that extra set of hands, just like just like Kimberly's business. Have as many people as you can in your corner to help with all these things. It makes a huge difference.
Absolutely.
I bet you love it.
I do. I'm very passionate about it.
Terri, tell us a little bit about you and I know a lot about you as your daughter, but for everybody listening, tell us a little bit about your background and where you came from and what you're up to now.
Well, I'm originally from Nebraska, but I came out here in 1972 after doing a year in pediatric ICU in Nebraska University Hospital. And I worked 20 years then at Maricopa Medical Center. And I worked in the burn unit, ER, ICU, patient education, started a neurology program, did lots of in-hospital stuff. And then when I had 3 children and they wanted everybody to work 12-hour shifts, I thought, life's too short, it's time to move on. So I taught at Gateway Community College, a nurse tech course for a while, and became an advocate for the American Medical Association Alliance to help with tort reform. And then I was a rep for a home IV infusion company in DME, which really taught me the sales aspect on top of the teaching career and bedside nursing I'd done. So I guess it was all meant to be stair steps. That's what I tell my kids, because then in 1996, my husband and I opened up a couple vein care centers, and we developed those over 22 years, so that pretty soon I had 13 nurses and 4 doctors and 2 sites, and we did really well for a long time. I loved the advertising, marketing. I got to do my skills, which was sclerotherapy and bedside nursing, but also my entrepreneurial spirit. And Kelly even came in and helped me and taught me social media even back 7 to 10 years ago when I didn't even know how to plug in anything. So all that's led to now I want to be a free bird. So in 2017, I told my husband, time to sell the practice. So we sold it and moved on so that now we can he works for a bigger company. It's called Center for Vein Restoration. And that way everything's done for us. We get to do patient care and no organization, we have all that help. And I work a little bit part-time with my husband, Nick Morrison, MD. And the rest of the time I travel to teach sclerotherapy and compression and all around the nation. And I'm in the International Compression Club. So I teach internationally too. So it's been a well-rounded career for me.
No regrets, right? With all those different things. For those people who don't know what sclerotherapy or compression is, can you tell us about that?
Yes. In the olden days, we used to think there was 2 things you could do for veins: inject somebody with painful saline or strip their veins out. Well, luckily, we got to quit doing that 26 years ago. So nobody in this world needs a vein stripping, even though they still do it in poor countries. And there's some real, I guess you'd call it, very neatly done vein strippings in Italy still, because they don't have the money for the catheters and the minimally invasive things we do here. But for my practice, for sclerotherapy means that I mainly do what we call like the skin veins, the cosmetic veins, things that people can see on their skin. So my husband, the doctor, and the other doctors and providers, they always close the disease veins that are refluxing and have this backward flow of blood that causes hypertension in your legs, so that you get restless leg and swollen legs and varicose vein problems that we all know about. So they fix the plumbing, I always tell patients, and then I get to do the finish work. I get to make them look pretty. And it isn't just cosmetic, though, because some people have so many veins on the surface that it would be still 20% of their blood would be out there in the skin. So with our elderly population and even some young women that have had, 6 children or something, those veins on their skin can rupture, bleed, get blood clots, DVTs, phlebitis, all types of things if they don't treat the outside part too. So you close a vein with a non-painful solution that's now trade named Sclera, and there's another one that everybody just calls it STS. And they're likened to be biodegradable detergents. In other words, they just irritate the inside of the vessel wall, and sclerosis means hard. It thickens the interior wall and gradually shrinks it down so that it's like a little collagen fiber in there. And when it does that, blood can't pool in it, so you don't see veins anymore. but it's a little bit of a process. But we use teeny, teeny, tiny needles for those needle phobic people. And I use a topical spray and a squeeze ball if necessary. And so we laugh and have a good time. We have the most laughter coming out of my room most of the time. And then afterwards, as part of that therapy, we put compression stockings on everyone. And what I found for 24 years is if you just stood up right after you had injections, like Dr. Oz said, oh, the veins disappear and you just stand up and go home. Well, no, because then the blood dilutes the medicine right away. And you can get bruising, matting, staining, lots of side effects. So if you cover it up with a good dosage, we call it compression. It's like getting aspirin. Do you want a baby aspirin or do you want a full aspirin? So I put a full aspirin on their legs, but they're very nice products now. They're not like grandma's stockings. They come in 50 colors and styles and shapes and everything. And that makes them more comfortable. We put it on and they say, oh, that feels better. And they may not like them in the summer, but I tell them to go out and buy their first skirt in 10 years because they've been hiding their legs and wear the compression and then come back in about 4 weeks and we do another session. So compression like that is, like I said, more either just cosmetic patients who only need their surface veins done or for medical patients who then need their surface veins treated. But compression overall, I've been an advocate for years because they say that 50% of women by the time they're 50 years old have vein disease. And so that means and my girls were much younger than that. I had them wear them all through their pregnancies. When Kelly was in real estate, you have to wear compression because you have to get the blood up out of your legs. And if you have vein disease, you're going to have problems the rest of your life. So compression now, I treat for everything from leg ulcers to just swelling, lymphedema. I could talk all day, so I won't. But I've gone into nursing homes, which I'm very interested with the other participants because I have always wished I had a little company that I could go out and wrap these little elderly legs with these little Velcro wraps. And I did a little test in Friendship Village, and I took care of 7 patients for free. The only thing is their healthcare paid for the little wraps. And I wrapped them up and had them sleep in these little Velcro wraps that are non-elastic and got all the swelling out of their legs at night. And they were able to either just wear their shoes in the morning or get their stockings on easily in the morning. And I got that lymphedema to get out of their legs. So there's no big bandages or anything anymore. So I would love to be able to do that as I get older to help people that are my age and older. So
Terri, can I ask you a question? What is all of the service covered under Medicare? Does Medicare cover all of that?
Yes, Medicare pays for much of the medical treatment. When they come into the office to get a diagnosis, they get an ultrasound scan to see what's going on. And Medicare is pretty good if it's not just if you say they have varicose veins, but if they have a scan that shows a certain amount of reflux, like it's 0 to 4+ reflux, and in the great or small saphenous veins, et cetera, they have parameters, but they pay for certain treatments. And sometimes some of the insurance will pay for a laser ablation, some will pay radio frequency, some will pay the new glue treatment. So yes, many people get insurance coverage. Now, the compression stockings is another story. It goes everywhere from flight attendants being able to get 6 free a year. Some insurances pay for so many a year, and other patients have to pay out of pocket for that part. But if they pay for just the wrap or just the stockings, but they get, $5,000 to $7,000 worth of treatment, then they don't mind paying for the stockings because they know that's an integral part. Does that answer your question?
Mm-hmm. Yeah, she did a lot of free care at the thing. I said, you need to make that part of your business. Of course, I'm saying, are we going to run this through your business? Or she loves doing all the pro bono for all the elderly people, trying to help them with compression. But I was thinking about, Kimberly, how your caregivers probably run into people who, could use the compression or, complain of their legs swelling or having problems with that. So,
yes. The caregivers are always helping them to get them on.
Well, and that's one of the things I taught after I sold the practice. I traveled to 15 cities nationwide and taught a fitting class. And so we taught them donning and doffing, they call it. So there's at least 5 to 10 tricks, starting with just rubber gloves up to some slippy gaiter things and some butlers, they call them. And it shows them very easily how to get them on and off. Even if they have, I had one man, he was 6 foot tall with a little 5 foot tall wife. And he said about himself, he had a big tummy and a bad back, so he couldn't bend over and she couldn't get his stockings on. And with a little slippy gaiter, he sat in the chair and just slide his foot into that stocking, and she could help him pull it right up his leg. So that's a major part of compliance, is teaching people how to put them on and take them off. So that's one of my specialties.
One very small thing, but it was a huge thing for those people.
Yes, for sure.
It is, for sure. And Stephanie, I was thinking about you because as a patient advocate, knowing that there is things that they can do about the swelling and, their veins hurting and, they're worried about this or that. So I thought it'd be neat for you guys to chat about that as well.
We could do in-services, so that they would be ready to just say, this is an option out there, like you said, as a patient advocate, so that they could learn. And many of the good suppliers that I buy for, like Sigvaris, Medi, Juzo, many of them have little videos on their websites that even show, once they pick a donning or doffing device, they have little videos that they can refresh with their family members, So it's not just like they need just me, but I teach the caregivers, and then there's lots of audiovisual stuff to help them after that.
Yeah, that's fantastic. We've seen this over the last 2 decades for sure. And I'm thinking of my younger sister who's had 3 children. She's in her 30s, but it's very painful for her. And she's been talking about having it fixed for years. But like most moms, they put everything off for themselves and just suffer through it. So I'm going to talk to her about this.
Well, and support hose for somebody like that. Kelly, she just wore athletic compression or something until she was ready to do something else. So there's options for people like that. Moms.
Have to start slow and work your way into the big guns. That's funny. Kimberly, tell us a little bit more about why somebody besides elderly people, we're talking about young moms. Tell us a little bit more of other people that would use a caregiver.
Sometimes we'll have a non-senior that has had some kind of accident or, even fallen and broken a hip or something. I mean, it happens when they're not necessarily senior, and we can help short-term or long-term. So some of the short-term clients would be maybe a month or something after they've been to the hospital, had what they needed done. Then they've gone to, some form of rehab. And then they need help at home for a short period of time. They can't bend over or whatever the case may be, so that we can help around the house with light cleaning or laundry or, just some of their basic needs until they're done with their physical therapy and ideally stronger and, back to normal.
Have you been seeing more now for, non-seniors who, let's say they get COVID and they're the only one in the house, with kids? Are you guys helping anybody that's had COVID that, needs extra hand because they just can't do anything?
The only COVID patients that we've had have happened to have been seniors.
Oh, okay.
I personally haven't had any yet, anyway, that were younger.
Yeah, I worried about that.
Seniors.
About, what if they were a single mom, like we were talking about moms, and they were the only one to help and they got sick, who do you call to to come in and step in and, like you said, get the groceries or do the laundry or do all the stuff that my husband had COVID for over 2 weeks. He was 15, 16 hours a day sleeping, I was it. So if they only have one person in the house taking care of themselves or somebody else, that'd be a huge plus if they had caregivers, even if they had to just, drop stuff off or do their laundry somewhere else,
Oh, sure. Yeah. Yeah. I mean, we would be more than happy to help. I just haven't yet come across somebody in the, sort of the younger generation. It's the only positive ones that we've had have been seniors.
Yeah.
Well, and then, all the services are still the same, really, just different age.
And the companionship piece of it, speaking of COVID, you do a lot of that, I assume, especially like when we were talking about Stephanie, if she has the, patient advocacy side, and you could have the, the companionship side for people who have out-of-state family, and they're the only ones here left, the seniors that are left by themselves.
Oh, yeah, absolutely. And there's some that are moved back home or moved back to a home or, a nanny pod or whatever the situation is, and out of some kind of independent living or assisted living. And there were the isolation, they were used to the activities and, the going down for meals and all these kinds of things. And not even necessarily like fearful of COVID per se, just not wanting to be, left alone so much. So we've had quite a few that don't have a huge amount of maybe physical, personal needs and things that we need to take care of. They just really need to have another human being be around them. And then, of course, it's one-on-one, so the risk would be a lot less, exposure from a lot less people.
Yeah, I agree with you, Kimberly. It's so necessary, the isolation, and it's just such a necessity to have that. It improves quality of life, and things have changed for them. Oh, and we're going on 6 months now. And I deal with families who thought, like they were taking their mom or dad to an adult daycare center, Monday through Friday. Well, those centers closed down. So now the burden of care is on the family. And, we can all jump in and do anything for 2 weeks or 30 days, but can we do this for 6 months, 12 months, years? So we found after just, a couple of months that families realized that the burden of care was too immense and they needed help. They needed those resources to come into the home. And the caregivers that's what they're able to do. The bathing, be a companion, light housekeeping, grocery shopping. It's just phenomenal to lift that burden of care.
That's huge for people, I'm sure, especially right now. What a blessing it is to have those people in your life, somebody that's the patient advocate like you, Stephanie and Kimberly, to know, we can help you with whatever you need. It's nice to have that help for sure. Stephanie, tell us a little bit about the patient advocacy. Who specifically are you helping? Besides just a senior in general, who are you more specifically helping, or why would somebody call in a patient advocate?
Oh gosh, anytime. If there's a planned procedure, you're going to go in and have a surgery of any kind, and there's going to be some rehab to follow that. Certainly if it's unexpected, because then it's really overwhelming. You didn't get to plan for it. For instance, perhaps there was a fall in the home and there's a fracture or break, and now we have to have a procedure. Many of the patients that I have visited over the years, you go into the home and they've been discharged from a rehab, and they're on hospice or home health, and they've just got a box of medications and a stack of 70 pages, and they're overwhelmed. They don't know where to start. They don't know how to organize their medications. They don't know why they're taking it. Really no established parameters to monitor, like blood pressure. So these are the patients. There's really, it's endless, the patients that an advocate can help with. But we're able to come in, look at those, like the face sheet, the history and physical, the medications, and help them move forward with a plan that meets their unique care plan.
And then, Stephanie, I'm assuming that you would then help find the resources, if they needed palliative or, hospice or home health or whatever it is that they maybe were lacking, to kind of push them in the direction of, recommendations of things that they should be doing.
Yeah, fortunately, I've had that experience of home health, private duty, hospice and palliative care, skilled nursing in the hospital system. So I understand all those areas of care, and when it's necessary to move forward with a particular type of care, for instance, hospice, you need to meet certain eligibility in order to get that covered by Medicare. And then, of course, once we have those conversations and we know the direction that the patient and family want to move in, then I can bring in all of the trusted partners here in the community that I've worked with for over 11 years. Because I tell you what, when you've got 3 to 5 things on your list that you need to do yesterday and you don't even know where to start, how wonderful. It's such a blessing to have one say, okay, we know where we need to go now. I want you to call, here's 3 companies that you can call that can come meet with you. And answer all of your questions so that you can just be the daughter or you can be the son. We don't need you to be the nurse, the caregiver. It's an immense stress. And we just want them to be able to spend that time with their family member and let us deal with the rest of the stress.
You also help them with insurance, like if they get a bunch of insurance papers when they come home, do you have some resource to help them with insurance?
Yes, I do.
It's terrible.
It is. I've heard some awful things, but absolutely, I have an excellent resource for that, and she's fantastic.
Oh, that's great to know.
Mm-hmm.
What's her name?
Oh, I knew you were going to say that. Now I'm going to have to go into my messages. You'll be so upset with me.
I know, I got to put you on the spot.
I believe it's Catherine Cable, but let me make sure I'm giving you her last name because I would be in big trouble.
That's okay. We'll make sure, Stephanie, they can get a hold of you and you can coordinate that.
Yes, I certainly will.
In homes, Kimberly, totally off subject or changing the subject. In the homes, is there a license required for home care agencies?
Not in Arizona. Unfortunately, there's really not a lot of oversight in the industry. So technically anybody could go and just get a general business license, get some brochures and business cards, throw up a name and kind of, off to the races. So I always recommend to people, there's a local, it's called ASNHA. So it's the Arizona Non-Medical Home Care Association. That's our local one. And then there's a national one as well if people are in other states. And they part of their association rules as an agency, we have to have all W-2 employees. You can't have 1099 caregivers. So it ensures that they are covered under all of our workers' compensation and liability insurance and all those things. So God forbid something happens in the home, they don't go after the client's homeowner's insurance. And they check like that everybody has certain levels of insurance. The best oversight is agencies that are contracted with the state through our Arizona Medicaid, which here is Access, or Altex is the Arizona long term. And those agencies like us that are also contracted with the state, we get audited from each insurance company that we're contracted with. And so, they're making sure that all the agencies should be doing background checks. They all should be making sure that they are, have had the training and all the things that everybody would like to think that all the caregivers have and that the agency is enforcing. But since there isn't oversight other than that, then that's really the only way to know.
Yeah, that's good to know for all of us, right? So if we're looking, obviously we'll use Home with Help, but if people were looking for, to bring caregivers in, you kind of just go off of somebody, like a referral from somebody you knew who had it, or, you met them in a networking group. But what a nice thing it is to know, hey, are they contracted with the state? Do they take Access? Or do they take these things that contracted with Medicaid? That's an easy question, right? To call and ask. If they're contracted with those things, then they're at least having to be audited. Is that correct?
That would be correct. Yeah. And you can have the peace of mind that they have the insurance, they've done the background checks, all the I's are, dotted and the T's are crossed.
Well, and to have a family who, you guys are a family, and to have a family-owned business makes a huge difference, I think, to, you're taking care of other people's families as you would your own. It's not like a huge corporation, that's why I always advocate for small business, and for family-owned businesses, and entrepreneurs, is because they care, right? Or else they wouldn't be doing what they're doing.
Well, sure. All the sweat and the grit and everything that it takes to do it. I mean, you got to have the heart in whatever it is that you're doing. Otherwise, it's not going to be very successful.
That's right. Speaking of entrepreneurship, I'd love to have each of you tell us a little something you wish you knew when you started in this journey, or a tip that you hope that everybody in entrepreneurship would know. Kimberly, is there something that comes to the top of your mind, that going through this grit, using all your resources,
right?
Sweat and tears?
Well, so personally, the first thing that kind of comes to mind, especially as a woman and a mom, is the self-care and the taking our own, be it exercise, physically, mentally, spiritually, whatever it is that's your thing, to make sure that you kind of checked all those boxes, because it's very true that if you aren't taking care of yourself, it's almost impossible to try to take care of everybody else. From a business perspective, I think I would have hired a bookkeeper person right away instead of doing it myself for the first year and then hiring one. And I mean, it's all worked out fine, but I think if I could go back, I think I would have done that sooner than I did.
Absolutely. I can second that and triple that and whatever. It's huge to have that burden off your hands, to not worry about one less thing, right? I say, do what you're good at and outsource everything else. That's my famous line. Because there's no reason for, what you're good at, and it takes you, and you're very efficient, right? If you're good at it and you like it, and that's why you started your business. But what's the point of spending hours and hours to do something that, could take somebody else 15 minutes? I mean, can you imagine how fast these bookkeepers are to do the numbers? I'm like, I am not a numbers person. I do not ask me to do any numbers. That's funny. Stephanie, tell us something that in business, in your journey along the way, that you wished somebody would have told you, or a tip along the way.
Oh my gosh, the social media. I know I'm not alone. I know I'm not the only one with a business that has no clue how to work Facebook or LinkedIn. So that's been my biggest challenge. I have allocated other things that I'm not good at. And thankfully I've got a good support structure surrounding me that can help me manage those things so that I can focus on what I'm good at. But yeah, social media, who knew it would be so challenging? My 5-year-old son could probably help me do it in a few years. I don't know.
Kelly's your best option.
Yeah. Yes. I am working with Kelly. Thank goodness for Kelly. I could never do what you do, Kelly.
Oh my goodness.
You guys are so sweet. One client said to me, it took me 2 hours to post that. I didn't know what to write. I didn't know how to write it. I'm like, oh my gosh, just please email me. I'm like, I can even do concierge on demand. Don't just send me what you have. Don't waste your time, It's a huge difference. Terri, tell us something that you can think of along the way. You've taught me a lot about entrepreneurship and motherhood and self-care, and I wish everybody could have a mother like I did. But tell us something that you thought was a huge win for you, or a tip that you wish you would have known before.
Well, the top two things I thought of when I looked at you is that I finally said to my employees one day, I used to tell my kids that when your dad and I leave for a vacation, I know you're sad, but I come back and I'm a better mom when I get back. Well, I'm telling you that you don't like it when Dr. Morrison and I go on a vacation because then you get a little slower. But you know what? I'll be a much better boss when I get back. So that was a really good thing I did. I think the thing that if I could go back, I grew us so fast that if I thought about doing it again, I think I would have liked to stayed in place a little more. Like we kept expanding and moving to bigger and bigger offices and expanding to Mesa, Tempe, Scottsdale, all that type of thing. And if I look back, I think I would have liked to had it kept it just a little smaller and maybe made people wait a little longer to come see us or something. But overall, I loved it. I loved the family and the culture that we grew together. Was a family atmosphere, and I would redo that if I wanted to grow this company again.
If you want to expand what you're doing now into more and more states and countries, let me help you. I keep pushing you. She's like, I don't know. I kind of want to do it part-time. I'm like, you're so good at it. You need to be going everywhere to keep doing this for everybody.
We'll see. I want to work with all these team members that you have on today so that they can arrange all of it and I don't have to grow my company. I can just go show them how to do it.
That's good. That's good. Pass it on, right?
Yes.
Kimberly, you and I are a lot alike. We travel a ton and Terri too. As part of self-care, right? I mean, that's back to kind of all ties in, right? Is back to knowing when it's time to take a break. So that's huge for everybody. I think for business owners and even business leaders, right? You don't have to be a business owner to need self-care time and to take some time to yourself and take a little break, even if you have to go camping or whatever you have to do to get out of here, for a little while. My daughter says, she wrote today, she half her day is in Spanish and half in English. So she says she was interpreting it for me, but she was writing in Spanish about her summer. And she's like, my mom says we need to get out of this crazy. So we went on vacation. Can you imagine what the teachers think when they're reading these stories?
It's true. I mean, you need a change of scenery. Yeah. I mean, everybody has their priorities, and not everybody's priorities are the same. But my husband and I, we make it a huge priority to travel and ideally, I mean, that my bucket list is really big. So I have many, many countries and many places that I would really like to go see. And we are firm believers that the kids are the education that they get when we are in other countries, and depending on where we are, sometimes they are very grateful because they see how other people live, and it's a different kind of education than what they're getting here in school. So, money that we save, that we set aside for travel, other people choose not to do it. But even if you, like you said, go camping, just go walk in the woods, a couple hours north of here, just go somewhere out of, your normal and get a break. As an entrepreneur, you don't really ever stop.
What a nice way to unplug and also teaching the kids, right? And teaching the next generation, like there's more to life than this little, we build a bubble, right? When we're home with our kids, like, but when you travel and you take them and see all these different countries and see how everybody lives and see the unity that we could have and see how everybody, is nice and, I didn't know that these, this tradition of this country or these, traditions of these people, what a cool thing it is. You can't get that education. We were fortunate as kids to get to go to a ton of different countries and do that and, volunteer and give back. And it's made me who I am today. I mean, I can't go 1 month without, I'm like, what am I going to do to donate my time? What am I going to do to give back this month? Because I'm like having that itch. Like I'm not, if you're not giving back, then something's wrong. I got to keep doing something else. So everybody is smiling, but nobody on air can hear that everybody's smiling. Isn't that funny when it's dead air? Like I wish you could see the video, right? When everybody's smiling and nodding. Tell me on a whole nother subject, some common myth about your field that somebody, if somebody hears of a home care agency or somebody hears of a patient advocate or sclerotherapy or compression, tell us if there's a common myth that you'd like to debunk, something that you want to make sure people know about your industry or your specific field you're in. Anybody can jump in.
Well, I can start just because I had a recent case. Most people don't know that veins are hereditary, and they don't know that if you have a family history of blood clots or strokes, that is part of your family history, and therefore you could have that. So it's very timely right now in the time of COVID that it's known now with the research that it can increase your chance of blood clotting. They call it microthrombi. And they're starting to know about blood thinners and compression, and they're finally starting to teach that because it's a whole inflammatory process. So it's what I've learned for 20 years, but I've had a hard enough time explaining why wearing compression stockings on half your body helps the inflammation in your whole body, So I would like it to get out more that if you wear compression stockings, and there's a million varieties, it might help you with the symptoms, even if you got really sick with COVID, or you just have to sit at your desk all day and be a home care teacher right now, and you don't get out of your chair. So I guess that concerns me, that I would like to people to know about blood clotting and all that type of thing.
And that it's not just seniors, it's not just elderly people that can get it. This is every single person is potentially getting a blood clot, sitting so long at home and not up and moving around, and then it can go into their lungs, and then it's bad news from there.
Yes, and most people just won't. They need a home health advocate, and they need somebody to come in their home and make it possible, because they don't know that if they got one blood clot, they're very susceptible to getting another one, and the second one might kill you with a pulmonary embolus. And over 24 years, I've seen a lot of that, and it just made me sad to just say, I had a sports guy one time, and he was afraid to wear compression. He was afraid another man might see him with compression stockings. And I said, Robert, put some ACE wraps over him or something so you look like you have a sports injury, but you travel all the time internationally, you're going to get a blood clot. And 5 years later, he called me with his characteristic accent, and he just picked up the phone and said, "You know who this is?" I said, "Robert, did you get a blood clot?" "Yes." But he was one of the lucky ones that didn't die from it. So, all that stuff just makes me so passionate about helping people with that.
Teaching people about getting up, moving around constantly. I mean, I even got, being at home before, we were in, networking groups and going to, client meetings and up and going, right? And so now being at home, being more sedentary, I even started to feel, where you don't have as much lung capacity. I don't know. It's weird. And then, so you said, get up, go for a walk, move around, calf muscle pumps, do your stuff. But if you wouldn't be there, right, if you don't have the patient advocate to say, get up and move around, go do your exercise, get moving, get some
drink water.
Yeah. If you don't have those people, then you're in bigger trouble for sure. Thank you for that. Stephanie, is there something that's a myth or something in your profession you'd like people to know?
Well, not so much a myth, but just for families to know they don't have to do this alone. Don't get to the point where the burden of care is so great that you're completely burned out. Now your health is at risk, because we see that all the time. That is not a myth. That is accurate. The burnout and burden of care can actually impact that person who's doing everything alone. So my advice to them is just to know that you don't have to do this alone. There are a ton of resources, and a patient advocate can meet with you and help you find an easier path and decrease that burden of care and get the care that you need in the home.
Great.
Absolutely. Don't you wish there was like 15 of you, right? You just duplicate yourself.
And Stephanie's right. Like people, they wait. If they're even thinking that they need help, or their spouse, they need help because their spouse needs help, or whatever the case may be. And it's partly that generation of you just push through, and I can do it, and I am independent, and I don't need help, and all these things. And it's like the idea is not to take away any of the independence. And I think that's a myth that a lot of seniors have.
Yes.
Is that somehow if I ask for help, then somehow I'm going to lose independence. And what they don't realize most of the time until we get somebody in there and they have it for a little while, and they're like, of course, I should have done this a long time ago, because it really makes them more dependent. If they couldn't drive, and now all of a sudden we can take them and they can still go to care appointments and go play cards and do, whatever, that all of a sudden they actually have more of a, social life in that sense. And it really keeps them to be as independent and safe as long as possible, instead of sometimes their way of thinking is somehow they're going to lose that independence.
Yeah, I've seen families in tears. They just have been trying to navigate things like the VA, or just do all of the care on their own. And then they've come to find out that we could get all of this set up and paid for through their VA benefit. Literally, I could come in and meet with a family for under 2 hours and give them the solution. A lot of people think that a patient advocate needs to follow you for months or maybe even days and weeks, but generally the solution is within the day, same day visit. You follow up the next day and give them the plan of care and the resources. And now they've been empowered to move forward. They have a clear thought and a clear path, and they've avoided months. And for some of the patients I've met with over the years, they've avoided years of heartache.
And you can't put a dollar amount on that, right?
No.
I mean, there's no dollar amount that would take that to be able to have the relief and the time back. I mean, right? To be so nervous about all of that, whether it's caregiving or patient advocacy or compression or, worrying about blood clots or any of it, or even in entrepreneurship, giving my clients their time back so to do what they love. It's right. There isn't money that you can put on that, I don't think.
Mm-hmm. Yeah. I think the thing as a personal is that Kelly really helped me with my mom, her grandma, is that she was a Depression era baby and didn't want to spend any money. She was very prideful that if she was going to spend the money, it was her money to have somebody come in and help, not for us to pay for it. So we had to sort of talk her into it, like you said, and we could have used the advocate to convince her to take the emotional side out. But once we got somebody in there and just said, let him make you lunch, Mom, and fluff up your house. And Kelly said, just think of him as your little helper, And once she saw that it wasn't like somebody going to come in and be domineering with her, pretty soon she was like, oh, they're going to help me take a bath. I don't need you to help me take a bath. Like, she had her privacy back in a way, she wanted them to help her, not us. And so it was very cute because it gave her spunk back. Mm-hmm. Very cute.
Yeah. And then you got to be the daughter and Kelly got to be the granddaughter instead of you being the caregiver.
It was great.
It's huge. You made a huge difference. I said to my mom, I said, how much are we making, right? And then how much are we spending to help her go to the grocery store, right? Or that. I said, let us pay for it. Oh my gosh, if she's not going to pay for it, I'm paying for it. Because it is not like I want to go sit with her. I don't want to run, into all her different things that I got to go do for her so that I don't have time to sit with her and talk to her and spend time with her.
It changed the dynamics, and that was the greatest thing.
That's huge.
Well, and the most recent patient advocates, like family that was using a patient advocate, the daughter is local, mom's in the hospital. You can't, because of COVID, you can't get in there, and so the patient advocate is trying to phone. But the other daughter's out of state, and the patient advocate / therapist is kind of what was sort of happening, which I'm sure Stephanie can relate to. But it was like kind of dealing with the family dynamics, and they needed the communication to not go from the floor nurse that the one daughter called and then trying to explain it to mom and trying to call the other sister and explain it. And it, just messy that way. So with the patient advocate, she was able to steer all the conversation and explain to everybody so that they were all on the same page to figure out what the next step was that was best for mom.
Absolutely.
Right?
Yeah, that's huge. Well, can you believe it's almost been an hour? We could talk for another 2 hours, I think. Before we end today, I'd love to know if there was one question that I didn't ask that you'd love to tell our listeners, and how people can get a hold of you. So a website or a phone number or an email address, either way. We'll also have it on the website, Phoenix Business RadioX, for after, and it'll turn into a podcast. But in the meantime, is there something that I didn't ask you? And then how can people get a hold of you? Stephanie, I'll start with you.
I don't know if you've left anything out as far as questions. I think that was fantastic hour that we just spent. The best way to reach me, I always say, is on my cell phone. I've had this phone number for over 15 years, so I apologize. I used to live in Florida. It is 727-385-9185. Email, if you're an emailer, srussell.cscm@gmail.com.
Thank you so much. Kimberly, what about you? Anything that I didn't ask you or you want to mention, and then how to get a hold of you?
The only thing additional I can think of is that outside of normal business hours, our office phones are always transferred to mine or my husband's cell phone. So even if they're just phoning the office, number, and it's 6, 7 o'clock, whatever the case may be, but they can reach us 24/7. I prefer you don't call in the middle of the night unless it's an emergency, but that's what happens sometimes. The office number is 480-941-0200. And the email is care, CARE, @homewithhealth.net.
And you can find them anywhere on any social media site, and the website's redone. We're all set.
And thanks to Kelly, you can go on LinkedIn, you can go on Facebook, you can go on Instagram, you can go on the website.
And very soon I'll be there because Kelly's helping me. Thank you very much, Kelly.
We were saying yesterday, I was saying to my mom, wait, we haven't even looked at your stuff in years. We better get back to that.
She tried to update me yesterday because it turns out with having 3 companies in this last 20 years, I had 3 different LinkedIn pages still open. So she's trying to help me consolidate those. So I'm the same with you about phone is probably the best, but I don't answer phones because I think it's scam. So I get so much spam and scam. They're still trying to sell me warranties for cars I haven't had in 12 years. So texting me on my phone number, 602-692-7066 is really good. And I have posted my long business name, which is Terri at tm@terrimorrisonconsulting.com, but an easy one too to remember once you know my name, Terri Morrison, that you can look up on anything. Terri Morrison 2002 at yahoo.com, and that's probably when Yahoo started. So just think of that.
Thank you all so much for being on. I loved having you all on the show. You've been listening to Collaborative Connections radio show and podcast sponsored by KLM Consulting. Clients of KLM Consulting can continue to do what they love while having the support they need, because we offer business development, concierge services, ongoing consulting, marketing, project management, and social media training. Tune in on the 3rd Thursday of every month at 1 p.m. Until next time, happy connecting.